So to decide between intrauterine insemination, which we call IUI, and in vitro fertilization, known as IVF, you would first need to do a workup with your doctor. And so that pre-testing or infertility workup would assess your egg quality, whether you're ovulating, the status of your tubes, and your uterus, as well as your husband's sperm, or what we call the male factor. And that makes a lot of decisions sometimes for you. If there's a serious male factor problem, or if your tubes are blocked, you would most definitely need to go right to IVF, because IUI won't work. But if the sperm are normal, if the tubes are open, the uterus is okay, and you either ovulate on your own or you can be made to ovulate with fertility drugs, then IUI certainly can work, and you're a candidate for that. There are other factors. Your age is a factor, and as women get older, past 38, they're less likely to be successful with IUI, and more of them would move directly to IVF, whereas younger women might more readily start with IUI. And then there's what's called the pelvic factor. If you've had a laparoscopy before and you've been found to have endometriosis, or you've had surgery before and have adhesions, those are things that would keep the egg from making it into the tube. And of course, IUI would fail if the egg couldn't get in the tube to meet the sperm. So if there's a pelvic factor like endometriosis or adhesions, that would also tend to push people directly to IVF. But if they don't have endometriosis or adhesions, they have young age, normal sperm, open tubes, then starting with IUI, at least first, is reasonable, and most folks would give it 3 tries. Most pregnancies occur either on the first or second or third attempt. And if you're not pregnant after 3 tries, the chance of getting pregnant with a 4th or 5th or more IUI becomes quite low. So that would be a point where you'd want to stop, reassess options, and maybe move to IVF or switch to IVF. But starting with IUI, if all those conditions are met, is reasonable. It is cheaper than IVF. It's simpler than IVF. So that the burden of treatment is less. And that's why a lot of people sort of gravitate to it as a starting point. Thanks.